in here, Isabel. Can you start us off by sharing your name and your role and what the Colorado Consumer Health Initiative does?
Thanks for having me. Excited to be here. My name is Isabel Cruz. I use she, her, they pronouns, and I'm so proud to be the policy director for the Colorado Consumer Health Initiative. So we are a nonpartisan membership-based organization whose mission is to ensure all Coloradans have equitable access to high-quality, affordable healthcare. So we do policy and advocacy work and also have a consumer assistance program, which helps people navigate issues with insurance and billing. So part of my role is to advocate for consumer-driven and focused policy at the Capitol to make healthcare better for people across their state and work with our consumer assistance program to see what issues people are having and to solve those from a systems level.
That's amazing. Thanks for all that you do. What health and healthcare and mental health related policy is CCHI working on in this legislative session?
So every session's a healthcare session because we know that even though sometimes we all might disagree on how to fix our system, healthcare is one of the things that no matter where you are in the state or what party you identify with, that people really have concerns with. And so I'll highlight a couple of bills that we're focusing on. So one bill our members and partners at Elephant Circle and Soul to Soul Sisters are working on is House Bill 24-1262. That is affectionately called Joy is Our Birthright. So what this bill is aiming to do is study barriers to reproductive health care across our state and expand options to folks across the state for community birth. So we know a growing number of folks, particularly Black and Indigenous people of color across our state, are opting to give birth at home and want providers like doulas or certified professional midwives to be with them and support them across that process. And we and our partners who are leading this effort believe everyone has the right to pick where they give birth and feel and be able to be supported by the people who they trust to be with them in this really sacred and important part of people's lives. So we are supporting this bill to study what some of these barriers are, help mitigate them. So you can check out ways to get involved at that effort on Instagram at Soul2Soul Sisters and Elephant Circle Co. I have a lot more information there. Another bill that we're supporting is House Bill 24-1075. So this bill would commission a task force to study and create model legislation, which essentially is like, how would this work for a system, a healthcare system, a universal healthcare system where it is publicly financed but privately delivered, right? So our system is focused right now, but be paid for and everybody would be covered in a different way. So studies have shown that this would potentially cost billions of dollars less a year, cover more people than our status quo. So we as an organization and many of our members and partners are really excited about this study to improve equitable access to healthcare across Colorado and really understand the mechanics of what such a major shift in our system would look like. Another bill that we're really excited about, House Bill 24-1218, would close loopholes in our existing laws regarding ambulances and the bills that you might get if you take an ambulance that's out of your insurance network. So currently in Colorado law, only private ambulance companies are prevented from sending you a bill if you take a private ambulance that's not covered within your insurance network. Public ambulances, which are actually the vast majority of ambulances in our state, are not covered currently by this law. So many people are still left wondering if an ambulance trip, most of which is at a time where you can't really think about what choices you're making, right? It's an emergency, is going to leave you with medical debt or make you scared of seeking care that you really need. And so we're really excited about this effort to close those loopholes and make sure more people really feel those protections against these out-of-network prize bills. And then lastly, a bill that we are looking at, and one of the bills that we're working to amend in partnership with other small business partners, like our friends, I know you all's friends at Small Business Colorado, Small Business Majority Colorado, so this bill is looking to change small group insurance market from going all the way up to folks with 100 employees back down to folks with up to 50 employees. So this would effectively shrink types of employers that could buy insurance in this market. And we would be the first state with this kind of expanded group to shrink. And there's not a lot of good data on what that's going to mean for insurance costs and coverage for the smallest of businesses in our state. So we've really been advocating to try and study what this would look like first, to ensure that it would lower healthcare costs, to ensure that this would equitably impact smallest of businesses in our state before we would move forward with such a monumental change. And then on mental health care, I will, because I've talked for a long time already, direct you to Mental Health Colorado, one of our fabulous members who really focuses on uplifting the voices of people directly impacted in their families or themselves with mental health conditions and challenges. And they do a lot of great work on substance use disorder and access to recovery services, on eating disorders and other types of really important issues facing our state where people are struggling to access care.
Well, thank you so much for all that. That was a really helpful breakdown. You talked about 4 different policies related to health and healthcare. We are about halfway through the legislative session in our state. Last question for you is just how can the RMMFI community learn more, get involved, and share their voice and their story as it relates to these specific policies and in this session?
There are so many opportunities this session and beyond to involve in these policies and others. We would love to have you all involved with us at CCHI. You can visit our website, cohealthinitiative.org, to sign up for our emails. We send out action alerts on these policies, information, and also opportunities for you to share your story with us and come to our events to learn more. Like just a couple weeks ago, we had a webinar on kind of the intersection of housing and healthcare, because we know that those are really issues that matter to our members and matters to people in the community. And we always love people's suggestions and ideas for what healthcare issues matter to you. I know we've heard, and I'm sure you all have heard from small business owners, that healthcare costs and accessibility are really a major concern. So we would love to have your voices included. And then if you want to know how all of I think there's been like 555 bills, of which several are related to healthcare, went to this session. We have a legislative wrap-up webinar and happy hour on May 16th. So save the date for that.
Amazing. Well, thank you so much, Isabel, for your insights and your leadership. We're excited to get more involved in this space. Thank you.
Yeah, we appreciate all of you. Thank you for all that you all bring to our communities with your creativity and your entrepreneurship. And we're always here to support you all as you navigate what I know is a really tough landscape regarding healthcare.